All right, Dr. Barry, thanks so much for being with us today and taking the time to interview. Appreciate it. So I guess to start us off, we're talking about the field of medicine and how technology has influenced it. So how would you briefly describe the largest impact that technology has had on medicine?
Yeah. Well, I'm a family doctor, so it has impacted a lot what I'm able to offer to patients. But in the specialty fields, like cardiology, you can now implant stem cells into hearts that have had huge heart attacks and hopefully regrow that muscle. I mean, so there's a lot of technology out there that I've been in practice for 32 years, and that wasn't there 32 years ago. So from the field of family medicine, I think that everything is electronic now. Our medical records are electronic, which means that I can get medical records from anywhere in the country electronically, depending on what the patient allows us. There's not as much privacy as there used to be.
What do you think are some of the major medical technologies that are common now that weren't common or even in existence when you first started practicing?
Okay. Well, the biggest technology is the electronic medical record, by far. Because of the electronic medical record, I have everything at my fingertips, and I'm on a computer. So if I want to teach a patient something, I can click into the computer and I can show them pictures and websites and what's going on. I can show them everything. So teaching is really easy. I can go into a database. Say we're talking about a disease that isn't very common to me and the patient has it. I can go into a database that is common to physicians. It's called UpToDate, and it has all of the latest research at my fingertips. And I can print out for that patient information they can read about their disease. So, and that's not just information that they would get easily from the internet because it's up to date. It's all the studies that have been done. It's looking at the most recent state of the art.
So do you think that patients are now more informed than they were 20 years ago?
Most patients come in when they have a concern. They've already researched it on the internet and have tried to figure out what they have, which is very good most of the time, because then they know, oh my goodness, I better get in there. Patients are very informed, and patients want to direct their care more because they are so informed, where medicine probably 30 years ago was more paternalistic, where the doctor called the shots and sort of directed the patient through things. Now we're in it together, and they're helping to tell us what they want and what they really don't want.
So how would you say that computers and the internet have changed the way that you communicate with your patients?
So when the electronic medical record was first introduced into our clinic, none of us could get used to it. Because before that time, we actually looked at the patient and looked them in the eye. And what's it like when you go to the doctor now? They're looking at the computer and you're typing in it, because the computer is kind of our slave master, our taskmaster. We have to get the information entered, and we have to finish that visit. Otherwise, we take all that work home with us and we finish it. So we're in a hurry to try and enter the information as we're talking to the patient. So if we're really good, we can kind of sneak a peek into that patient's eyes, but most of the time we're looking at the screen as we're talking to them. And patients have gotten so used to that sometimes when I look at the patient, they're not even looking back at me. They're just used to not being looked at.
So do you think that that's decreased the quality of care then that you can give to patients, or do you think that there hasn't really been an impact in that?
I think that it has. Most of us try not to have it change the care. Because we still really care about what the patient is saying, but there's times that you have to just put the computer aside and just look at them, because they're telling you things of such life significance that you have to ignore the technology and go back to the real way.
Right.
So
I guess what was it like And when you first started practicing, what was a normal day like then as compared to what is a normal day like now?
It was wonderful. So an average day for a family doctor was we'd get up and we'd go to the hospital and we'd see our own patients. And the hospitals that we used were usually close enough to our town that we could do that. And then you would see patients and everything would be in a paper chart. And that paper chart was kept under lock and key, so it was kept very private. Let's see. I dictated everything, so I didn't have to type anything. And one of the hardest parts when you are under a time crunch is that computers are still computers.
Yeah.
Which means that my idea of hell is watching that little circle on the screen going grrr as I'm waiting for it to do something. And sometimes I will wait for a full 60 seconds before I can write out a prescription for a patient that would have taken me 10 seconds the old way, or I could have just written it. Really easy to make mistakes now using a computer, where in the old days when you were writing it by hand, you wouldn't make mistakes. You were physically writing it out. Nowadays, when we first started using electronic medical records, the pharmacy would call us back and say, did you really mean that you wanted me to give the patient 330 of these instead of 30? Because you hit the wrong and you're in a hurry. So it's easy to make mistakes. Nowadays, you're looking at a screen that just has all the patient's names on it, and you're clicking on that name to open up their chart. So it's not unheard of when you run back into a room to tell them an x-ray result or something that you click one up or one down and you're on the wrong chart. So really easy to make mistakes.
Yeah. So we talked a lot about these electronic medical records and kind of the computer technology that's changed medicine. How about some of the other technologies, such as even pacemakers or stents and things like that? How have we seen that develop?
Technology is amazing. What we have to offer to patients that improves their quality of life is amazing. But with advances in technology also come questions that we as a culture maybe weren't ready to answer. So in medicine, there are so many issues in bioethics. There's so many ethical issues regarding the use of that technology. So for example, when we first in the 1980s, when we were first able to make a test tube baby, that means that we could take the sperm and the egg aside from the couple and fertilize them in a test tube and then reimplant them into the couple, into the woman so it could grow. Nowadays, we could design the baby because genetics allows us to select out for certain traits. So if you know that you have an embryo, you can look at the genetics of that embryo. You can select away from that, which the ethical implications of that is pretty significant.
Right. When taken to the extreme, like what ramifications could that have?
Well, it means that you would want a perfect baby.
Right.
So do you change the intelligence in a person? Do you change what you perceive as beautiful? The traits? It's interesting because as a culture, your generation especially is going to have to answer a lot of these questions about what technology is capable of. Technology has gone faster than we as the medical profession can keep up with the ethics of it. And since they were able to map out the entire human genome, every single gene is known. So what are the implications of that? If I know that you carry a bad gene, should you be allowed to reproduce? It's interesting. It's more than we ever even wanted to have to answer, but are being forced as a generation because we have that technology to answer. So
it's very interesting. So technology, while presenting us with tons of amazing advances, also does have its drawbacks in this field.
Yes,
unanswered questions that we have to deal with as a society.
Where does life begin? when does life end?
Yep.
Those are age-eternal questions. Can I choose now that patients want to be so involved in their care because they've got all this information at their fingertips? Can they ask the physician to end their life if they feel that they're suffering too much? There's a lot of questions. Yeah.
Well, great. Thank you for taking time today to talk with us about this. It was very insightful into how technology has shaped and changed the field of medicine.
Yeah.
Thank you.
You're welcome. Thanks, Matt.